Is there a cure for hand arthritis? The answer is yes, but it's not in the way you think. It's not a sickness that you can be vaccinated for, or it's not like a cancer that you can have removed or go through chemo or radiation and be in remission. And it's not an illness that comes on through like germs and you can take an antibiotic and get rid of it. It's a degenerative condition for which most healthcare professionals would say there is no cure. But I disagree, and I'm going to explain to you exactly why. Hand arthritis is caused by a muscle imbalance that can be corrected and can put you in a situation where you can have improved flexibility, decreased stiffness, less pain, be able to sleep better at night, and get back to doing all the activities that you love to do without worrying that you're going to make your hand arthritis worse over time. And in my book, that's a cure, despite that your x-rays show you still have osteoarthritis in your hand. Let me explain this degenerative condition and how it relates to the muscle imbalance. The most common spots to get hand arthritis are going to be in your joints, in your fingers here, this knuckle and this knuckle, as well as in the other fingers, same knuckles, and also in the base of the thumb. If you look here on the table, I've got a drawing of the bones of the finger, and they're supposed to be this finger right here. So there's the fingertip bone, 1. Here's the middle bone right here, 2, and then the base of the finger, 3. So on my hand, it would be this bone, and this bone. And then the blue stuff is the cartilage in between the bones, because you have cartilage to allow movement in the joint. Then you have a couple of tendons, which are what connect muscles to bone. You have one that goes to the base of the finger, runs down into the wrist, into the forearm, and then you have another one that runs down right here as well. These tendons help to bend this finger. When this one gets pulled right here by the muscle, it bends this joint right here, and then when the purple one gets pulled, it bends this joint right here. And you can see on my forearm right here, those muscles live down in here. You can see if I bend all my fingers here at the tips, even just these, it's this that moves right here. As opposed to my palm, if I just close my palm, you don't get much movement down here. And hint, hint, that's kind of the muscle imbalance there, is you're using these fingers too much and not the palm enough. And what happens as a result over the years is if you use this too much, then you get a constant compression of that cartilage and the joint, and it sets up the joints to be compressed and to look like this. Then you start getting pain and stiffness in the joints. You have a loss of cartilage. You can see there's no more blue right there. And then they thicken as well. That's why I've drawn them thicker and even a little bit shortened, because you get these thickened joints, these thickened knuckles right here. They call them nodes, N-O-D-E-S, because of the constant pressure that's happened from this tendon pulling on that joint, and then the tendon that connects to the fingertip pulling on that joint right there. And what needs to happen in order to take the pressure off the joints at your fingers here, and it's a similar situation at the base of the thumb, is we need to strengthen the palm muscles right here so that you use this muscle here in your palm and take some of the pressure off these muscles right here. That would be putting you in a muscle balance. Now, this muscle imbalance doesn't happen overnight or even weeks or months. It happens over years. And let me show you what that looks like. If we just draw a graph here, and let's pretend this starts at your 20s, then you have your 30s right here. And I keep going. Right around 60s is when arthritis develops. And then of course your 70s and 80s. Now on this side over here, let's write strength. And if you think about where we're starting, in your younger years, your strength's relatively high. And if we're looking at your palm strength, let's put that one in orange. Palm strength tends to decline pretty quick, and then it flattens out and stays weak for most people as they age. However, finger strength stays strong, sometimes even gets stronger to compensate for the weakness, and then you hit a point where it starts to decline as well, especially as that arthritis sets in because of your joints getting irritated. Now, it's usually in this range right here where you're dealing with the muscle imbalance. And it's causing that bad pressure going through your joints and slowly breaking down the cartilage, causing too much pressure to the bones, and they're adapting by getting thicker. And somewhere in this range, what the muscle imbalance will cause is carpal tunnel. Carpal tunnel is when the nerves get pinched in the palm of the hand right here. You can get pain that goes into your fingertips, and it's usually because you have weak palm muscles that aren't supporting the tendon, or the ligament that goes right there over the carpal tunnel. This is why people that once had carpal tunnel eventually can develop hand arthritis. I'm going to write OA for osteoarthritis. It's the same muscle imbalance as you move across. As you age, it's not an age-related problem, it's a time-related problem with the muscle imbalance present. The more time you spend with weak palm muscles and overly dominant finger muscles, the ones that bend your fingertips, you're putting pressure through those joints and wearing down that cartilage, thickening the bone, and then your body hits a certain threshold where by your 50s, as early as your 50s, definitely 60s and 70s, things get broken down, you start to get that thickness, and now you have full-blown hand osteoarthritis. This can be prevented, however, if you keep that palm strength up. All right, palm here, and then finger on the outside, so you can keep track of what muscles we're using here. If you were to keep this palm strength up, then you can technically just keep going to the end of life like that, and finger strength should theoretically just keep going along with it. That means you're in the right balance, and then you shouldn't be having a hand arthritis problem or a carpal tunnel problem as you hit your 80s. This is why this is a degenerative condition that you break down over time, but it's misread as an age-related problem. When doctors say that, when healthcare professionals say that, they're implying that there's no way out, that you're just going to get it no matter what, that as you get older, you're going to degenerate. But this is a preventable problem if you fix the muscle imbalance. Guys, I've got tons of videos on how to fix this muscle imbalance. Check out the playlist in the description below. And if you want more in-depth, streamlined, organized information, I've got a program called the Hand Arthritis Recovery Program, where I break down my entire treatment approach step by step, and I show you everything in phases. We have 4 phases for this program, and I walk you through each phase so that you can improve your hand arthritis, get it to calm down, get the right palm muscles strengthened, get shoulder muscles that need to be involved as well strengthened, and get you to a point where you're feeling happy, healthy in your hand, and back to doing all the things that you love to do. I mainly explained arthritis, how it works in the fingers and not the thumbs, but I have a video in case that's your situation or you want to learn more. Check out this video that goes into more depth about how thumb arthritis works and what to do about it.